All right, thanks, Ashley. With October being Breast Cancer Awareness Month, we continue to highlight the different techniques and options available to women who are diagnosed with breast cancer. Here to talk about a new mammogram technique, contrast enhanced mammograms, and surgical techniques is Dr. Niamey Wilson, the Associate Director of the Breast Program at Hartford HealthCare. Doctor, welcome.
Thanks for having me.
Thanks for being here. So tell us about this new mammogram technique, contrast enhanced mammograms. What is it and what are the benefits?
Yeah, it's a great new addition to our mammogram repertoire. Basically, what it is a standard mammogram, but during the procedure, the woman has an IV that's placed in her hand, and she'll receive intravenous contrast just like a CAT scan. And so as the contrast is circulating around, the mammogram is performed, and basically we're looking for bright spots that light up on the image. And this is very similar to what you would see on an MRI. This does not take the place of your standard mammogram, so everyone still needs to have their regular mammograms. But this is a great new addition for women who have high-risk family history or maybe a history of atypical cells on a biopsy.
Okay, it's so vitally important for women to schedule their mammograms. At what age do you recommend women start the screenings?
Yeah, we usually recommend sticking with the majority of the guidelines, which means 40 for average risk women. Now, if you have a genetic condition or a history of breast cancer in your family, that age may differ. You could potentially start younger. But, you know, mammograms are so unbelievably important. They really do save lives. A woman is diagnosed with breast cancer every 2 minutes in the United States. And if we can catch those cancers when they're small and screen detected on a mammogram, the treatment is going to be much more doable, much less intense, and those cancers are going to be more curable.
All right, what does it mean if you have a genetic condition or a family history of breast cancer?
So a genetic condition really means that if you have a genetic mutation that you've inherited from your mom or your dad, then you have a small abnormality in one of the chromosomes that you've inherited. It's a little change in the DNA in one of the chromosomes. And so that can confer a really high risk of breast cancer if you have one of those little changes. So the way to figure that out is to do a simple blood or spit test. You should talk to your doctor to see if you qualify for the testing, and it's a very straightforward procedure.
All right, doctor, and finally, tell us about some surgical techniques that you use in the OR to minimize scarring.
Yeah, we use a lot of various techniques to really hide the scar as much as we possibly can. Myself and my colleagues, we use something called hidden scar. So this is where the incision for the surgery is placed in a natural crease of the breast. And so over time, the incision kind of fades away and they don't really see it too much after treatment is all done. I perform something known as nipple sparing mastectomy, which is where the incision is placed underneath the breast and all of the overlying skin and the nipple complex is all preserved. So the appearance afterwards is extremely natural looking.
That is excellent news. All right, Dr. Niamey Wilson, thank you so much for your time, and we encourage every woman to pick up the phone and make their mammogram appointments, right?
Yes, absolutely. Thank you so much for having me.
Thank you for your time.